There's new research to suggest people about to undergo surgery could reduce the need for addictive painkillers by using acupuncture. Let's take this to Dr. Joe Kostrich now. Dr. Joe, what are the benefits of acupuncture?
Good afternoon, Jerry. Yeah, interesting work out of the United States, and concerns about opiates are worldwide, including here, where we've had over 1,000 deaths annually from prescription drug overdoses. But in America, those numbers are, 60, 70,000. So this work looked at people undergoing surgery and gave one group acupuncture and another group sham acupuncture, which is an interesting concept. I'm not actually quite sure how you do pretend acupuncture, but maybe you use needles that don't penetrate the surface or don't have any effect. Anyway, they know how to do it. Interestingly, in both the studies, they found the need for pain relief, and particularly use of opioids after surgery, was reduced by 50%, and in the second group by about 2/3. So fairly significant decreases. They also found in the group that had acupuncture that they had less anxiety, and they also reported much less nausea. So small numbers. The numbers studied were quite small, and the researchers said, look, we might need to expand this further, but very significant findings, albeit in a relatively small number of people.
So do you think it can completely eliminate the need for opioids, or does it sound like some people weren't impacted by it?
Look, I think that's less likely. When they're saying reduced by half, that doesn't mean you don't need it at all. But certainly a significant reduction is good just overall, but also makes it more likely that if your dose is lower, you're going to be able to wean off it more quickly. And that's the biggest problem that we have when people end up with opioid problems, because they were started on it for all the right reasons, but then don't sort of end up weaning off it. So lower doses and for less periods of time, that is an achievement in itself.
So the study actually showed a difference between two types of acupuncture. Is that the sham acupuncture you mentioned earlier, or is there another kind?
No, there are actually two forms of acupuncture. And again, when you research these stories, Jerry, it's always interesting to find. They spoke about traditional acupuncture. I think a lot of people would be familiar with that. They put the little needles in meridians on different parts of the body. This other form called battlefield acupuncture is something I've not previously come across, and was apparently developed in the 50s for use in the army, and they basically only put the acupuncture needles in the ear. And again, this is based on the concept of meridians, and this is the whole basis of acupuncture. It comes from China originally, that these meridians run through the body and they can be interrupted. So this battlefield form also was effective, same as the traditional, but the other point with it, not only is it just in the ear, but the needles are left in for a few days rather than just a matter of minutes to half an hour or so.
I see. All right, well, aside from acupuncture, any other alternative methods for pain relief you can suggest?
Yeah, look, absolutely. The most critical thing, and there was an interesting essay in the New York Times a couple of years ago by an American who was having surgery in Germany and said, well, they were going to send her home and told her just to take some paracetamol. Resting up after any form of surgery is important. So we should be not keen to just say, well, look, we'll do whatever we want. We'll just take painkillers to numb the pain. Use of simple analgesics such as paracetamol and ibuprofen can be helpful. Depending on the sort of pain one is experiencing, acupuncture may be helpful for musculoskeletal pains. We're not talking about post-surgical pain now, Jerry, but for a lot of muscle pains, physiotherapy, massage can be helpful, exercises, stretching, and obviously dealing with the underlying cause of the pain. So rather than just immediately relying on on painkillers, we can be looking for other methods.
All good stuff. Dr. Joe, thank you for your time. Have a great weekend.
Thanks, Jerry.